Hello, everyone. Many times I get kids, they ask me, Doctor, what is a cavity? And then we have to answer the question. We tell them, oh, those are just tiny little holes that have been created by sugar bars that are eating at your teeth. And like, okay. But so, yeah, they ask us the question, but what is actually a cavity? Okay, so a cavity is basically a deterioration of your tooth structure, usually the enamel and also other surfaces that are beneath the enamel that create as we say, sometimes they cause a cavitation or little holes on your teeth. And so those are what cavities are. So how can you recognize that you actually do have a cavity? You can recognize it by looking at it, by seeing it. Sometimes basically you can't really tell because they can develop in areas where you can't really see them. And that's the reason why a dentist will come into play as far as diagnosing, different types of cavities. But sometimes you can see like some darkening of your tooth structure. You can your tooth. You can see some areas that may be white in colors, and that can be surprising. But that can start the cavity process, and usually or many times on smooth surfaces. So that means just like on maybe like the outside of your teeth or the inside of your teeth area where there are no grooves. They can you can see those white spots. Sometimes white spots are not cavities, but sometimes they are. Like for instance, we see them a lot on people who drink a lot of acidic drinks like sodas or lots of juices, and even on people who have braces and who are actually not going at their oral hygiene properly. You can also see those white surfaces or those beginning of cavities or demineralization of their enamel, and it can show as white areas. You can also see it on babies. On the outside surfaces, you can see those small kind of like circular areas that are white, and those can be the beginning of the formation of a cavity. Also, dark spots in the grooves of your teeth can also signal that you have a cavity, okay? But as we said, it's not all dark spots that are actually cavities or caries, which is the actually also other term for cavities. So every dark spots are not necessarily a cavity. Sometimes it could be a staining, just staining for people who drink lots of coffee or tea. You can have those stains on your teeth. Also, you can also have dark staining of some parts of your teeth that are due to hard plaque, which we call calculus. Sometimes they can show or they can have that brownish color or that black color, and that may or may not be a cavity, which is again reason why you want to go to a dentist so that they can actually diagnose the problem. But those are ways that you can notice that visually that you have cavities. White spots or brownish or darkish spots on your teeth may signal that you have cavities. Now, that's visually, right? But you can also sense that you have cavities. For example, when you eat something sweet and you have pain, that can signal that you have a cavity. When you drink something cold or hot and you have pain, yes, that usually signal that you have cavity. And obviously, as well, visually, you can see big holes. You know for sure that you have a cavity. So, what should you do to prevent, first of all, cavities? Okay, so number one thing is you want to definitely be very cautious and very meticulous about your oral hygiene, because that would be one of the main reasons why you may have cavities or develop cavities, because you're not brushing your teeth properly, you're not flossing your teeth, and also you're not having regular or routine checkups at the dentist. And so I told you what you may not do. So what you need to do is to make sure that you're brushing your teeth at least twice a day. You want to aim the toothbrush in a 45-degree angle. So lodging the bristles of the toothbrush between your gum and your teeth in a sweeping away motion. So you're going to be sweeping as well the bristles of the toothbrush away from the gum surfaces. That will ensure that you're actually removing food debris and bacteria that get lodged between your gum and also between your teeth. Okay, so that's number one. You want to make sure that you do that at least twice a day, morning and night. Don't forget the night, because at night we have less salivary flow, or you produce less saliva. That is going to help you as far as preventing or making it hard for bacteria to actually adhere to your teeth and starting to eat at your teeth. Okay. Now, another thing that you need to do is make sure that you are flossing between your teeth, because the bristles of the toothbrush are too thick. Even though they're so small, they're too thick and they don't really reach the areas between your teeth. Okay, so it's kind of like, those little areas, those little crevices between, or the space between maybe a fridge and the countertop. Yeah, those areas, you can't really reach them very well just with a broom. It's hard to reach, right? So that's the same thing. You want to make sure that you're flossing in a C motion. So you're going to hug the surface of the tooth with the floss that you actually want to clean. And then after that, when you're done with that surface, you're going to hug the other side for the other tooth. So you're going to do that, and that's going to help you as far as removing surfaces, debris between your teeth. Because there are many times where we see people, they do a good job at brushing their teeth, but when you take the radiograph, which is the reason why I told you earlier that sometimes you can't really see, there's some areas that you cannot see with your naked eye. We can't see them with our naked eyes as well. That's the reason why you have to take x-rays, and with the x-rays we are able to tell that you have cavities between your teeth. And believe it or not, there's some people, as I was trying to say, they have very good oral hygiene as far as brushing on the outside surfaces of the teeth, but where they lag is, or where they're not doing a good job, is at flossing, and that can cause them to actually develop interproximal cavities or cavities between the teeth. So flossing at least once a day is going to be very important. You also want to, on a routine basis, go to your dentist so that you can have good cleaning at least every 6 months. That way we are removing the very hard tartar or calculus, the hard plaque that gets caked on your teeth and that are very difficult for you to remove. We have special tools, special instruments to actually remove them, and that's going to help you. Okay, so that's what you need to do to prevent cavities. And so what do you do if you actually now have a cavity? Okay, so number one thing you want to do, definitely go to the doctor. They're going to devise a plan, a treatment plan that they're going to share with you as far as what needs to be done. You may need maybe a filling. Okay, you may maybe need a crown. You may need a root canal. You may need a tooth to be removed because it's no longer restorable. And believe me, or trust me, the teeth that you have removed, it's not hopeless. After a tooth has been removed, you can still replace or restore the missing tooth area. Okay, so it's not all lost, even if the worst case scenario has happened and you need to have a tooth removed. But you definitely want to address the issue, because a cavity is not static. It's not because it just started, it's gonna stay at that position. It's gonna keep growing and growing and growing. And so that's the reason why you want to go and actually take heed to the recommendation of your dentist. That way, we can prevent getting to a point where that tooth is no longer restorable. Okay. The last thing I wanted to talk to you about, as far as making sure that you take care of your teeth, is make sure that you drink lots and lots of water. Because what I did not say is the caries process, and I want to talk to you about it right now. So it's bacteria actually feasting on the food that stay in your mouth. And so when that happens, they create acid acid which is going to aggress your teeth and is actually going to start creating, that deterioration of your tooth structure. So because of that, you want to drink lots of water. You want to make sure that you stay away from a very sugary foods that bacteria love. You want to make sure that you kind of like decrease the amount of acidic fruits, acidic drinks that you take, like sodas, like, juices. And you want to make sure even after you have taken those that you drink lots and lots of water, because that's going to help you as far as washing out some of this acid that is lingering on your teeth. Okay, so that's what I wanted to talk to you about today. What is cavity? How does it happen? What can you do to prevent it? And if you do have them, what can you do to actually correct the problem or treat the cavity so that you can become caries free? Now, even if you have actually undergone the process, you have you needed a filling and you had it filled, okay? You had it filled, or you needed a crown and you got it done. You want to make sure you have to keep going to your doctor so that they keep cleaning your teeth really good, because if you don't, you can actually have cavities come back, that's recurrent cavity. That's the scientific term. And so just because you had treated a problem doesn't mean that it cannot happen again. Okay, just kind of like cancer. Just because you had cancer and then you ended up being in remission doesn't mean that one time you cannot have it again if you are not taking heed at watching whatever you eat and all of that recommendation of the doctor and everything. Okay, so it's the same thing. All right, so that's what I wanted to talk to you about today. I'm Dr. Valerie with Healing Wings Dental, the place where we help our patients maintain and regain their oral health and their smile so that they can soar in life. Okay, you can come to us. You can give us a call, 972-213-0202. We'll be happy to become a part of your oral health journey. Okay, and we are located at 4101 West Quinault Boulevard, suite number 317 in Arlington, Texas. And that being said, I am excited to see you next week for another talk about how to take care of your teeth or your oral health. Take care. Bye-bye and be blessed.